Hi, I'm Daniel Kwon. Happy to present my poster on informed decision making for veterans with advanced cancer who are considering germline testing. So we did a study of 31 veterans where we did a mixed methods approach with qualitative interviews after their conversation with their oncologist talking about germline testing at the VA. We also administered a survey. We really want to find out how informed are they when they're making decisions about germline testing, and are they incorporating their preferences. What we found out was that out of 31 veterans, most people agreed to testing, but 4 declined because of service-connected disability benefit concerns. They were concerned that if they tested positive for germline testing, that they would somehow de-link their benefits that were linking prostate cancer to a prior military exposure, and they were getting decent financial benefits. Since this poster came out, there's been a change in the Veterans Benefits Administration pension language, giving some high degree of protection against such concerns. The second thing we found out is that even though most people pretty much know a lot about germline testing from their oncologists and have a pretty easy time and low uncertainty based on their surveys about germline testing, there's still some people who have some decent information needs and misconceptions about genetic testing. For example, here in the knowledge deficits here, we can see that people have a lot of questions, like what's the genetic test process? Some people thought it was just a family history collection and not a blood test. There's a lot of misinformation too, like fear about weaponization of their genetics data. And a lot of people face barriers, some facilitators to genetic testing. So what we're trying to do next is take what we learned and develop into a decision support intervention for patients and help patients become better informed when making these decisions.